Good evening to one and all present here. Prayer doesn't change God, but it changes the one who we praise. Let's begin the day with prayer. Now, I call upon Darshini to start this event with a devotional touch.
नमो हरे अन्तानं नमो सहतानं नमो आयर्यानं नमो वजायानं नमो लोये सवसहुनं एसो पञ्चनमोकारो सर्वपावपनाशनो मङ्गलानन्दे सर्वेसिं परमं हवै मङ्गलम् परमं हवै मङ्गलम् நீராறும் கடலொடுத்த நிலமடந்த கெழிலொழுகும் சீராரும் வதனமென திகழ் பரத கண்டமிதில் தெக்கனமும் மதில் சிறந்த திராவிடனர் திருநாடும் தக்க சிற பிறை நுதலும் தரித்தனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிடமை திரும்பிய செயல் மறந்த வாழ்த்ததுமே வாழ்த்ததுமே வாழ்த்ததுமே.
Thank you for the wonderful start, Darshini. I now call upon Subiksha to deliver the welcome note.
It's my great honor to deliver the welcome address in front of you all. We all have gathered here recognizing the National Cancer Awareness Day. I feel very great in welcoming you all to this great event. I take immense pleasure in welcoming our resource person, Ms. Divya Lakshmi Srinivasan. I thank our program officer madams and the management for organizing such an event. I welcome each and every person who has been present here by sparing your wonderful time with us, and I also request you all to give your presence till the end. Thank you, and I would like to call upon Pratipa to address the gathering with a note that why have we gathered here.
National Cancer Awareness Day. The day is important for it educates people about the serious threat that is cancer. According to the World Health Organization, cancer is the second deadliest disease which causes death among people. The condition of people dying by cancer in India is a serious threat to the nation. In 2018, 1.5 million people from India died of cancer. Thus, to raise awareness about cancer, the day is observed on 7th of November every year. Today, we have amongst us a resource person, Ms. Divya Lakshmi Srinivasan, pursuing BOT at Savita College of Occupational Therapy to be a part of our awareness for the dreadful disease cancer. Without delaying, I would like to hand over the decorum to you. Now, it's over to you, ma'am.
Shri, thank you. I would like to thank the organizers for giving me opportunity to create awareness among the NSS students about cancer. Thank you, ma'am. And I would like to start my presentation by sharing. Let's start. What is cancer? Cancer is an uncontrolled growth of normal cells in body, and cancer develops when the body's normal control mechanism stops working. That is the normal cell division and apoptosis of the age cells. Uh, First of all, cancer is an abnormal growth of normal cells in the body. Okay, and what is the role of a cell? A cell will develop from a stem cell, and then it will do its work, that is like metabolism and its normal function. When the cell gets aged, it will undergo that process, and it is called as apoptosis. It means programmed cell death. If this mechanism, that is apoptosis, is impaired, that the cell is going to be alive for a longer time. And if there is also a problem in cell division, that is a normal cell division, this is also going to cause cancer. In case of cancer, the old cells do not die and instead grow up out of control, forming new cells and abnormal cells. These extra cells may form a mass of tissue called the tumor. Okay. How can we differentiate a normal cell from a cancerous cell? In normal cell, the cell division takes place. Um, the mitosis and the meiosis is in a normal phase. Okay. And when the cell gets aged, it will undergo cell suicide or apoptosis. It is a normal function. And if the cell is mutated, like if the gene is mutated in the cell or the DNA imbalance, so that the normal cell is going to be cancerous. And so the cell division is enormous, and the cell proliferation is uncontrolled, so that the cell is not differentiated to any particular cell. The stem cells are going to be proliferated in enormous number and form a lump or a tumor, and so this is called as cancerous cells. And the cells will never respond to the growth inhibitory responses. Okay, the tumors are of two types. That is, one is benign, and other is malignant. For benign tumors, a tumor is said to be benign when it is gross and microscopic appearance or innocent and remains localized, and this will not spread to other sites, and this can be surgically removed locally, and the patient usually survives. Those mass of cells are there, right? That abnormally grown cells, those are going to be called as tumors. The first one is benign. Uh, these are uh, these are lumps, but these can be removed at the initial stages itself, and um, the patient will survive. There are the chances of survival are more. And in malignant tumor, these tumors can invade to the adjacent site and spread to the distant sites through metastasis and cause death. Okay. Next, characteristics of a cancerous cell. The self-sufficient growth signals. So, if a cell have to be undergoing cell division, so it must receive the signals from brain and other body parts, that are growth signals. Okay, if there is an wound in a body, say for example, then there should be cell proliferation to cover the wound. Okay, the regeneration of the skin should take place. So the cell has to be grown. The signals from the growth hormone, like those things, should happen, and it will stop after the specific growth. But in cancerous cell, these cells will never respond to the growth signals. These continues to grow as if it likes. And motility. The cells will remain in the place where it should be. But in cancerous cells, these have the high motility behavior, and it will spread to other parts. What it is the most a next is mortality. Next is sustained. Okay, immortality. These cells will never undergo cell death, that is apoptosis. They are resistant to cell death and activated anti-cell death signaling and inactivate to the cell death pathway. And next is sustained angiogenesis. Okay, genesis is new formation. Angiogenesis is formation of new blood vessels to the cancerous cell. So it means whichever part of the body is getting a good vascular supply, that is the blood supply, is going to be healthy. And these cancerous cells are going to have a sustained angiogenesis, that is blood supply. So these cancerous cells are more powerful than the normal cells, and these are going to grow and spread rapidly. And invasion and metastasis, it is the very important point, because this is only very important determinant of the stages of cancer. It is going to determine the stage of cancer, because if I said right, tumors can be benign and malignant. Only the malignant tumors are going to cost a life. Okay, and this is because of invasion and metastasis. Malignant cells grow locally, while malignant cells invade neighboring tissues, enter blood vessel, and metastasis to different size. Okay, what is metastasis? Metastasis means, say for example, breast cancer. The cancerous cells, that is multiplication of abnormal cells, are going to take place only in the breast. Um, but what does it cause a fatal disease? Why does it become a fatal disease? So because the cancerous cells are going to spread all among the body, either through lymphatic system, or through the blood, hematologically. If it is going to spread to other parts and cause damage, it is going to be fatal. And this spread of cancerous tissue from one particular area, for example breast, through the lymph node to liver or bone or some other organ, completely different other system, then this is going to cause multi-organ failure and ultimately death. So the metastasis is the spread of a tumor cell or the cancerous cell from one area to other area, and this makes it fatal. Yeah, coming to statistics, India is likely to have 17.3 lakh new cases of cancer, and about 8.8 deaths are due to the disease of cancer. And the top most cancer prevailing in India is breast cancer, lung cancer, and cervical cancer. Sorry, cancer of the cervix. Indian Council of Medical Research predicted, sorry, yeah, predicted that in 2016 the total number of new cancer cases is expected to be around 14.5 lakh, and the figure is likely to reach 17.3 lakh new cases in 2020. Over 7.36 lakh people are expected to succumb to the disease in 2016, while the figure is estimated to shoot up to 8.8 lakh by 2020. The data also revealed that only 12.5% of the patients come for treatment in early stages of disease. It is so less that only 12.5% come for treatment in early stages. Actually, cancer is curable, or at least we can increase the lifespan of the person if it is detected in the early stages itself. Cancer of breast is estimated about 1.5 lakh, over 10% of all cancer new cases during 2016, and is the number one cancer overall. Cancer of the lung is the next, and it is estimated with 1.14 lakh. It is more prevalent in male, that is 83,000, and in females about 31,000 new cases during 2016, and 1.4 lakh cases in 2020. Cancer of cervix is the third most common cancer, with estimated 1 lakh new cases in 2016 and about 1.4 lakh during 2020. Cancer associated with the use of tobacco account for about 30% of all cancers in male and female, as said by the Indian Council of Medical Research. Among male, there have been a significant increase in the case of cancer in colon, rectum, prostate in Bangalore, Chennai, Delhi. While among women, it is like breast cancer, uterus, ovarian cancer, and lung cancer. One woman dies of cervical cancer every 8 minutes in India. For every 2 women newly diagnosed with breast cancer, one woman dies in India. In India, as many 2,500 people die every day due to tobacco-related disease in India. Yeah, smoking accounts. Yeah, most of the tobacco cases are like smoking only because and also that snuffing those products and all. And smoking alone accounts for 1 in 5 deaths among men and 1 in 10-20 deaths among women, accounting for an estimate of 9,30,000 deaths in 2010. Estimated number of people living with the disease is around 2.5 million. Every year, new cancer patient registers over 7 lakh. Cancer-related deaths are like 5 lakh 56,400. That's in age group between 30 to 69 years. And the total is 3 lakh 95,400. And in men, it is like 2 lakhs and 100 people. And women, it is 1 lakh 95,300. Yeah. Okay. Let's move to the next one. The causes. What causes cancer? The tobacco use. The tobacco use in any form like cigarettes, snuffing, whatever it is, like people take it orally also. This is a major cause of cancer. Next is alcohol consumption. Not alcohol consumption also causes cancer. This is going to uh, damage every part of the body, including the blood, kidney, and brain. Also, this is going to, if it is not also going to if it is not going to cause cancer, also it will affect other parts of the body. Next thing is radiation. Radiation exposure. It's mostly like occupational exposure. Yeah, it's given in the next point. Moreover, it's occupational exposure. People working in radiology department and other factory like things which are exposed to the radiation. Uh, these radiations are going to damage the cells, especially the cell DNA, and going to cause mutation of those cells. So these mutated cells are going to proliferate in enormous number without any control to the growth signals. These are going to proliferate and cause tumor. And further, if it is left untreated, that is undiagnosed and untreated, this is going to uh, be malignant and may cause death. And reproductive factors. Cancers like prostate cancer and cervical cancer, uterine cancer, ovarian cancer, cancer in fallopian tube. These are going to be caused due to the reproductive factors like unhealthy sexual practices and multiple partners in sex and things like those. These are the reproductive factors causing like cancers like cervical cancer, prostate cancer, etc. And occupational exposure, of course, I said it before in the radiation itself. An unhealthy diet. An unhealthy diet means uh, people consume products like frozen products, stored products, and those are going to cause cancer. It is given like burger and French fries are going to cause cancer. Actually, if it is done in a good way, if it is not frozen or preserved, like those things, then it's okay, fine to take once or twice in a month. That's okay. But it is a continued routine food. You're going to take a fast foods and things stuffs like that every day, every time, like breakfast, dinner, lunch, for everything, and it is going to damage your every part, not only stomach. This is going to damage your cells, blood, and everything. Next, certain microbes like human papilloma virus causes cervical cancer and cancer of the cervix, and hepatitis B, C, or those virus causes cancer, jaundice, and all in liver. Hepato means liver. So these virus will cause cancer in the liver, may cause cancer or may also cause other disease also. And obesity, of course. If you take unhealthy diet and you lack physical activity, obviously obesity is going to take place. And extra accumulation of fat in the body is like it is going to promote the growth of cancerous cell. So obesity is also a reason cause, and these are also the risk factors. And family Family history. This means the genetics, inherited genes of what to say, the cancer. Family history, like father or mother of the person having cancer, or brother or sister, the blood related relatives having cancer, there are high risk for the cancer in the person also. Okay, tobacco alone causes 14 types of cancer. Nose cancer, mouth, nose about 125 people, mouth 4,500 people, larynx, that is, larynx is the place where your esophagus and the trachea is going to be connected. Larynx is called as, okay, take it as voice box. You know voice box, right? That is what is called as larynx. And esophagus. Esophagus is a tube that is going to connect your mouth to the stomach, and it is also called as like food pipe, that is only is called as esophagus. About 5,600 people are affected, and lung 34,000 people, 600 people, and liver 800 people, stomach, pancreas, bowel, kidney, urinary bladder, cervix of the uterus. Okay, this is only uterus and sorry, cervix and ovarian cancer are going to occur only in female, because these are the places, I mean, parts of female reproductive system. And leukemia is the blood cancer. So tobacco alone is going to cause these cancers. Alcohol. Next thing is the alcohol. Alcohol is going to cause about 7 types of cancer: mouth and upper throat, larynx, esophagus, breast, liver, and bowel. Those things. Symptoms of cancer. Okay, I have grossly plotted the symptoms here, and I have mentioned a few special what to say, specific cancers in the next slides. Okay, let's see the gross general symptoms of cancer. Unexplained changes in your body, like hair fall, sleeplessness, like that. It is unexplainable. Why do you get headache? You don't know why. And why do you feel nauseating, vomiting every time? You don't know why. Like explainable changes. And sudden appearance of a lump. A lump is like katti, you say, no. Sudden appearance anywhere in the body, in the breast, or in the skin, in the face, like leg, foot, especially. Maybe you have a lump, sudden appearance, and blood in urine. This is called as hematuria in a medical term. In medical term, there's a presence of blood in urine, and change to your usual bowel habits. That is, people may go and free themselves in the restroom about in the morning. People have habits, right? Every day morning I used to do, and like that may be changed, or people may not be have a very good consistency. They may have like constipation, either constipation or loose stools, like that. And lump in breast. Yeah, next. Coughing, chest pain, and breathlessness. These are symptoms of lung cancer, like that. Coughing, chest pain, and breathlessness. Yeah, difficulty in breathing is called breathlessness. And changes in bowel habits. Yeah, that's the same thing. Bleeding anywhere, like gum bleeding, teeth, it's bleeding, like that. And wounds which are not healing that fast, and all. Moles, like black color spots. You say macham, right? Every, like newly coming. Those are called moles. And unexplained explained weight loss. This is very main indicator. That is unexplained weight loss. Laryngeal cancer. Okay, I said, right. Let's consider the voice box. It's called larynx. Persistent hoarseness. The change in voice. If you get cold and all, your voice will change, like karagar, like that voice. That is called as hoarseness. And soreness in neck. Yeah, when we get common cold also, we can feel the soreness in neck. But these are also a warning sign of cancer. Like not all the persistent, hoarseness and soreness is going to be cancer. Only if it is persistent, like 2 to 3 months, it is continuously causing pain, and it is always sore in the neck. And these are going to be something which needs a clinical examination, and feeling the lump in throat, difficulty in swallowing food. Yeah, difficulty in swallowing. You can't even swallow saliva or food like liquid substances, and then it might be a warning sign for a laryngeal cancer. Next point is oral cancer. The cancer in the buccal cavity, the mouth, teeth, palate, everywhere. Persistent white or red patches present in buccal mucosa or palate everywhere, like inside the mouth. Any persistent lump or swelling, any lump or swelling, or like you say that vingi pona mari, like swellings, fixation of the tongue either to the palate or to the floor of mouth. The tongue is fixed, and non-healing ulcers. Some wound will come inside the buccal cavity, inside the mouth, and it will not heal rapidly. If you like uh, um, it will not heal. You will get wounded even with the toothbrushes. Okay, but that will heal in 3 4 days, 3 to 4 days. But these ulcers that comes will never heal. It will be delayed. It will never heal. So you need to go and visit a doctor and reduce the mouth opening. The opening of the mouth is difficult, and it is like a short range of motion, and it is like a small opening to the mouth to take foods and all. And lung cancer, warning signs of chronic cough. Chronic is persistent. Chronic means like continuously ரொம்ப நாளா இருக்கு, like those things are called chronic. And chronic cough, coughing out blood, changes in the voice, that is the hoarseness of voice, like those things. And chest pain, yeah, the patient will complain about chest pain. Shortness of breath, uh, that is like breathlessness. They have difficulty in breathing and shortness. Their breathing is swallow. Sorry, shallow. Their breathing is shallow. They can't take a deep breath, and they have breathlessness and all, difficulty in breathing. These are the warning signs of lung cancer. The next one is colorectal cancer. Okay, this is the cancer in large intestine. Yeah, people know large intestine, right? Colon means it denotes large intestine, and rectum is the ending point of the large intestine, the rectum, and then the anus. So colorectal cancer refers to the cancer in large intestine. Blood in stool. People may have people may see blood in stool, either, and feeling of being bloated every time. They they feel like bloated. They don't like eating, or they feel bloated. Changes in the bowel habit and constipation. Constipation are warning signs of colorectal cancer. Next is esophageal cancer, difficulty in swallowing and recurrent indigestion. Prostate cancer. This will occur only in male because prostate gland is present only in male. So trouble in urinating. Uh, decreased force in the stream of urine. Blood in semen. Discomfort in the pelvic area. Bone pain. Erectile dysfunction. And these are the very very common points, warning signs of prostate cancer. Actually, these need special attention. These symptoms, if it is not a cancer also, needs a special attention. We should visit a doctor and consult him. Stages of cancer. Early stage, first, actually there is stage 0 also, where it is like starting initial stage, and that's okay. That is not going to be diagnosed. And stage 1, early stage, a small invasive mass or a tumor has been found. In stage 1 only we are going to find tumors. It is invasive. Invasive means it is going to go inside. No spread to the lymph node or other tissues. Sometimes called early stage or the localized stage. Localized is only present in that area. it is not going to spread to other areas. A small lump or tumor is found at the first stage, and in early stages, if we find if we are diagnosed the patient or someone who is diagnosed with cancer, they are going to be treated, and treat if they are going to take up the treatment, cancer is curable. Actually, cancer is curable if it is found in the early stages. Only a certain type of cancers are non-curable, but most of the cancer detection at the early stage is curable. And coming to the next one, localized. The cancer started to affect the nearby tissue. Mass may have grown in size, spread to lymph node near the mass. Localized, yeah. If say for example, if it is like breast cancer, for initial stage, the first early stage, small lump is found, and a second localized stage, this is going to spread to the next lobes of, yeah, breast have lobes. If the cancer is going to start in one lobe, this is going to spread to the other lobe, and so the spreading is called as second stage, and this is uh, going to be seen in the lymph node also. This is going to spread to the lymph nodes, adjacent lymph nodes also. Next is the regional spread. Cancer affects more surrounding tissues. Mass may have grown in size, spread to the distant lymph node away from the mass. And in this stage, this is going to spread to other lymph nodes and all, other places and all. In localized second stage, for example, in the breast cancer, this is going to affect only the axillary lymph node, which is near, like it is the armpit is near to the breast, right? So this is going to affect only the axillary lymph node. And in regional spread, this is going to spread to other parts through the lymphatic system, to the liver, to the bone, to the uterus and all. And distant spread, yeah, this is the malignant stage where it undergoes metastasis. Cancer has spread to other tissues or organs beyond the region, and yeah, sometimes called the advanced stage of cancer or metastatic stage. This is the stage where can't help we can't make the person to survive or live. We can just expand their lifespan. Like, there is no cure for the cancer, but we can just give some supportive therapy and can expand the lifespan, but death is for sure. Pathway of spread, how is this going to be spread? Like lymphatic spread, I said, right? This is going to spread through lymph, and hematogenous spread is via the blood. Yeah, what is lymphatic system? Yeah, this is called the lymphatic system. This is going to absorb any infection and all. These are going to have that immune response of the body is generated by the lymphatic cells, lymphatic system only. And this contains the immunocells like WBCs and monocytes, everything. And natural killer cells, like those cells are present in the lymph, lymphocytes, everything is going to form the lymphatic system. I said, right? In the breast cancer, you can see the axillary lymph nodes here. See, yeah, this is going to spread everywhere to the body if it is left untreated. And next is through, yeah, next is through the blood circulatory system, where we have the arteries, veins, and this is going to spread through blood. Next one is, sorry, I just kept. Ah, the other way of spread is seeding of body cavities, that is transcelomic spread. The malignant tumor are going to rise in body cavities such as peritoneum, pleural cavity, precardial, joint space, subarachnoid. These are like medical terms where, sorry, anatomical terms. Peritoneum is a place in the abdomen where, for example, there is a cancer in the intestine. This is also going to spread to the liver, stomach, pancreas, because these organs are placed in one area, and this is going to be covered with a fascia, and that fascia is going to be called as peritoneum, and that peritoneum is going to have fluids fluid, and that is called as peritoneal fluid, and this cancer cells will spread through the fluid and causing spreading cancer to the other parts. And pleural, this is the covering of lung from one place to the other place. Say for example, if the cancerous cells are present in right lung, this is going to be shifted to the left lung or the trachea and other part of the respiratory tract to the pleural cavity. And pericardial is the surrounding of the heart and joint space. Subarachnoid is like where the cerebrospinal fluid will circulate. This is like a central nervous system, the brain, spinal cord, like those things. Spread among the epithelial cells. For example, the cancer in the endometrium spreading to the ovary through fallopian tube, and cancer in the kidney spreading to the urinary bladder via ureters. Yeah, I can explain this within a image. Okay, say for example, if the kidney is affected with cancer, then the cancerous cells are going to spread through the ureter. Can you see this ureter? And the cancer is going to lodge in the bladder. So the kidney is affected, and ureter is an epithelial cell line through which it is carried, and then it is spread to the bladder. Likewise, in the likewise in this also, yeah, let's see. Endometrium is the inner layer of the uterus. You can see that this thing, endometrium, and cervix is somewhere connecting the endometrium and vagina. It is called as cervix of uterus. So if there is an ovarian cancer, okay, this is going to spread through the fallopian tube, and then it is going to reach the endometrium, or the vice versa also. Then cancer in the endometrium is going to be transferred to the ovaries also through the fallopian tube. And okay, next the treatment. Treatment will be like radiation therapy, surgery, chemotherapy, targeted cell therapy, and hormone therapy. Radiation therapy, in which the doctor or the physician, whoever is treating, the therapist is going to pass on the radiation, the rays, targeting only the cancerous cell without destroying the other cells. Most probably, the doctors will try to destroy only the cancerous cell, but in case of radiation, this is like spreading thing. The normal cells can also be affected. Next is surgery. In case of, I said, like breast cancer and other benign tumors, they will remove the tumor, and so once the tumor is removed, it is not going to spread, and the cancer is cured. Maybe to prevent relapse, they will follow some simple medications, but the person is safe, and he can continue his normal life. Now, for example, is the breast cancer. If the lump is at the early stage, they are going to remove only the lump. If it is in the second stage spreading, and they are going to remove the lump and also the axillary node along with those lymph nodes and all. And after removing the lymph node, the doctor may ask the patient to lift his arm above the head, so that the drainage is the lymphatic drainage is going to take place with the help of gravity and all. These are the simple exercise we recommend after a surgery for the breast cancer. In case if it is like next stage in the regional third stage and all, there are also possibilities of removing the breast radially, like lobular, like there are many options for surgery. Even the removal of entire breast and the other non-affected breast is also there. See, the life is more important than possessing things like that. So to save a life, uh, you should undergo such surgeries. Next is chemotherapy, yeah, the medications, drugs and all that.
Your, sorry to interrupt, ma'am. Your full screen has been disabled. Could you please give the play again so that we'll be getting it?
Yeah, okay. Yeah. Is it visible?
Yes, ma'am. Thank you.
Okay. Yeah. We say awareness, awareness. Why should we need awareness? Not only for cancer, for HIV and other disease, like people say, like diabetes also. Awareness, awareness every time. Why should we need awareness? Yeah. Let's see why do we need awareness? Because prevention is better than cure. And diagnosing any disease, not only cancer, any disease at the early stage is going to save a life. And medicine is not only about saving life, it is also about to reduce the suffering and pain of a person. It is so much needed that saving life is as important, but like reducing pain and sufferings, people undergo like lot of suffering due to many disease. So this is also as important as saving life. Okay, let's get into the cancer topic. Diagnosis at the early stage of cancer is curable. That is what the tumor lump, like initial stage with small size of lump, and it can be removed surgically. If not surgery, chemotherapy, radiation therapy, and targeted cell therapy is is more than enough to remove, like cure cancer and remove the tumor from the body. Early diagnosis and treatment reduces suffering from the disease. The sufferings is suffering and pain, and whatever the patient is going through is like nobody should have that. Like those things. If we create awareness and all, like if they come early and they get checked up, and if they are diagnosed and undergoing any therapy, like a treatment, any therapy, even if it is surgery and all. Okay, surgery, if done 1 or 2 years, it is going to have some side effect and all. And next year and other months and all, they are going to live a happy life. So it is better to be diagnosed early so that it is curable. Most of the cancer are curable. And awareness about the causative agents. Like causative agents, I said, like the occupational exposure and the tobacco, alcohol use, and unsafe sexual practices, everything that those are only called as the causative agents. So the awareness about that and reducing their exposure. Okay, if someone is like in the initial stage of alcohol addiction, or like starting like okay, let's try alcohol or tobacco, like that stage. And if they are aware of like using tobacco or alcohol is going to cause cancer and all, they will reduce that exposure to the tobacco or anything else. And occupational exposure, and one is if we educate someone who is exposed to radiation and all, they are going to take the precautionary steps, and they are going to um, undergo the medical examinations regularly. The possibilities of reducing the cancer is high. So only we are creating awareness so that they will reduce their exposure to the causative agents. And a person who is aware of the disease can create awareness among other people, and also help people to reduce their sufferings. Okay, if a person, not only a person who has a doubt, okay, maybe I have cancer, only not only that person is going to be educated. If he spreads awareness to other people, then other people are going to get knowledge about it, and they also reduce the risk of cancer. Okay, risk of getting cancer for them. So if we educate one people, if we make them aware, one person, that person is um, going to create awareness among other person. So by creating awareness, we can reduce the possibilities of person getting cancers. Next, why do NSS students, especially the NSS students, social workers, and all, should be aware? You should be aware. Like you, you cannot take it for granted. Okay, let me know, or that's my choice. Maybe I may be aware, or I may not be aware. That's my personal choice. That's not like that. Like social workers and NSS students, because you have the more possibilities of visiting rural areas and all. We say this as a community based rehabilitation. You people will go to the village on field. You people will meet people like who may be illiterate people, or people with low socioeconomic status and all, with the rural cultural based and like ethnic people and all. You go inside the areas and all, you are going to meet people face to face. This opportunity is we won't get we are like paramedical students, but we don't get opportunities to meet such people. But NSS students have that possibilities of visiting many rural areas, and you can create a great awareness to the people living there. Everyone should be safe. Every life matters. Not only the people in city are like eating unhealthy food and are not physically active, so that these people only are going to get cancer, and these people are going to pay money and see and see doctors, consult doctors, and get treatment and all. Not like that. Even the village people, rural people may have unhealthy sexual practices, and these people may get infection and all. So these people are also going to get cancer. Even those people's life matters. So everyone should be aware of cancer, and you have very good possibilities, and you get opportunities to meet such people. And you may also get chances of meeting cancer patients and visiting cancer centers and all. So you can have an idea. Okay, this person is at this stage. Okay, we can help them with this or that. You will get an idea. Okay, if you are aware about cancer, like stages and all, what are the treatment and all, like the side effects of treatment, it is like like hair loss, hair fall, like dryness of skin, fatigue, and the people will be like emotionally drained, very low and all. You can like identify and act according to the situation of that person. So you have to be aware of that. And NSS students can create awareness to a large number of people in a mass communication with the support of GOs and NGOs. Okay, I have this one doubt. You people will go to the village and areas like that, and you will like conduct seminars and all those things, right?
We
Excuse
would
me.
be creating awareness, door to door campaigns, and surveys.
Yeah, you will create awareness to the people, villages and all, right?
Yes.
Yeah. Okay. Yes. That is what is called as mass communication. Like if I am taking a seminar and you people like 40, 50 people are here to listen. If it is like or if there is a doctor and he is going to say his patient and few group therapy and all, it is going to be like 10 to 15% maximum. A doctor can educate his patients alone. And if he is going to like conduct conference and seminars and all, he is going to educate the educated person, already the literate person only. But NSS students, they are going to do service, and they are going to educate even a person who is not educated, giving sharing knowledge and creating awareness to the person who is not educated, who doesn't know what is a literacy. You can also educate an illiterate people, and you can create awareness to them, because their life is also matters, right? Yeah, the mass communication word, it is like you go and speak up to them. You can arrange for a meeting like thing, and you can teach them. You can use the chalk and talk method, like you use a board and use a chalk and demonstrate these are the things going to happen in cancer, and you be aware, and you can educate a mass is a large number of people. That too, like innocent people you're going to educate. It's very important that social workers are very important, and they are going to create awareness like this. And you can also include something like you can create awareness by doing dramas and all, like plays, role plays, dramas, and these are the ideas. You can gather people like village side and all, they will say, right, terukutu and all, they are organizing like that. Also you can create awareness about cancer, and by singing songs, like changing the lyrics, and creating awareness about the cancer, singing songs and all in the streets of village and all, the people will gather, and they'll look what is happening, and what are they saying, what is cancer. They will get awareness about that. It is not always like paper presentations and PPTs or conference. And not only that, you can also try like this, like dramas, singings, role plays, and all. This is also going to cause awareness among those people. This is very important because you're going to educate a mass number of people, not one or two people. Okay. Yes. The next point, can participate in primary prevention activities like health education. That is what I said, right? Like chalk and talk movement and all, and health promotion programs. Yeah, my friend said that she will go. The NSS students will go, and like you will set up like medical camps along with the doctors and sisters. You will help them and all. Those are the health programs, promotion programs. Okay. The next point, yeah, levels of prevention. This is very important. Um, Tertiary prevention, that is the last stage of cancer. We cannot save the life. We can just like இன்னொரு extra ஒரு வருஷம் 2 வருஷம் you can extend their lifespan. You can rehabilitate them until they live. You can reduce their pain and sufferings. You can help them and all. Last stage of cancer, like you can rehabilitate the patient, only that you can do. That is called the tertiary prevention. When you visit like cancer institutes and all, you can do only this thing. And secondary prevention is the early stage of cancer. Yeah, this is very important because of the if you are aware, like you are feeling pain, we saw that warning signs and all, right? Like pain, blood in urine, and unexpected, like unexplainable body changes, loss in weight and all. Please go and check a doctor. In early stage, the cancer, most of the cancer are curable. At least you can take treatment to increase the quality of life. So this is secondary prevention. Next is primary prevention, specific casual factors of cancer. That is, I said, like the person who is consuming alcohol or taking tobacco or uh, exposed to uh, exposed to radiation or taking unhealthy diet. They uh, they are at a risk of cancer. They don't have cancer. There is no lump. There is no initial stage of cancer. Nothing. They are not having cancer. They are healthy only, but they are at the risk of cancer. Not only at the risk of cancer, like a heart attack, myocardial infarction, and other, like smoking people will get like lung problem, emphysema, other disease and all, like liver cirrhosis. Other disease can also cause. So primary prevention is like taken a lifestyle modification. We can give lifestyle modification, not modification, like okay, try to quit smoking, quit alcohol, like eat healthy, follow regular exercise. Like those things is called primary prevention. These group of selected group of people who are smokers, who are alcoholics, who are following unhealthy pattern of life, those are selected patients. They are not patients. They are selected group of persons who are at high risk. This is very important, and we can prevent. Okay, so this is primary. And primordial prevention, this is very important because I said, right, you are going to educate people, adults. It doesn't mean that you are going to educate adults. Awareness is for everything, everybody. I said medicine not like service is not only to save life, it is also to reduce pain and suffering. Okay. If you are going to save life, it's okay, fine, but to reduce pain and suffering, you also have to educate the next generation people. That is the children, small children will be like 5 6 years. You should educate them. For example, in India itself, for example, in India itself, before what 40 years, polio is a deadly disease. It is most of the children are going to be affected with polio, and people are not aware of that. It is caused by a virus. Okay, poliomyelitis is caused by a virus, and people are not aware of that. Most children are born, and they are disabled, like paralyzed, like kaal varadu, you will say, right? The paralyzed person, like hemiplegia, paraplegia, like that. They cannot function at all. It's a deadly disease. People were not aware of that. And then the WHO, the Indian Medical Council, everybody, like came forward and okay, we should create awareness. Let's start creating awareness. They started creating awareness to the adults and people who are affected with the tertiary, secondary, and primary, like selected groups who are all in the area where the virus is like consuming food and water unhealthy, and it is spread to the oral. Okay. Excuse me. Anybody's there? Excuse me.
Yes, ma'am.
Yeah, where do I leave?
Yes, you have completed the levels of prevention, and after that, we have to.
Yeah, I would like to add a point about primordial prevention, the importance of primordial prevention, because you have to educate the young minds. You are going to give a healthy life to the next generation. You have to educate the small children. Okay. For example, I was saying about this in India before 35 years, there was a deadly disease called polio. Most of the children, like 70% of the children born in India, are affected with polio. Poliomyelitis is a disease that is going to cause paralysis of the limbs. Okay, paralysis is like kai kal varadhan solvangala. Yeah, that one. Exactly what this happened in India. Most of you can just ask your father or mother, because their age group of people, most of the children born in India are affected with polio. It is called poliomyelitis is caused by a virus. Okay. And people were not aware about that, and then the WHO and the Indian Medical Council, everybody just uh, teamed up and held a conference, and they started like pulse polio immunization. Do you know that சொட்டு மருந்து போடுறாங்க? Let's go and get it. Every time people say that, right? Every year, even in the news and all, like local TV channel also, they will telecast that news. If there is, if in any area they are going to give pulse polio immunization. So they created an awareness about that, so that today in India, the children are born healthy. That is, children are born healthy and they are not affected by polio. Okay. They will give that sotu mandu to every children and all. They just started like community based rehabilitation only. That is what you do. We say this community based rehabilitation, you just go to the village itself and you will give that door to door service. Okay. So that only it is the deadly disease polio has been like eradicated. It is eradicated now. Nowadays you cannot see like persons affected by polio. It is very rare. It is still there, but it's very rare. But once before 30 for 30 35 years and all, it is everywhere. You can see at least in a family of 5 children, at least 3 children affected by polio and all. So it is you should know the importance of awareness, so you can create awareness, so that people today there is no polio like that. One day there will be no cancer at all. Like very rare cases will be there. So primordial prevention is you should educate not only to the current generation but also to the next generation. In current generation, like 40 years, 30 years, 20 years old adults will have the habit of using tobacco, alcohol. It is hard to stop. It is hard to quit those things. But if you educate a 5 year 6 year old child, like you should not take like a tobacco or cigarettes or alcohol when you become an adult and all. You will educate so that the child is not, possibilities is less, like not at all going to touch and all. We can't give a surety, but the possibilities of doing that is less. And you can also say them like eat healthy. These are the things you like you have to build mold them from the from the childhood itself, and practice regular exercise. This will be their lifestyle. So this will be their lifestyle. It is not a thing like I am affected by cancer and then I am changing myself for this and all, like not like that. So the primordial prevention is very very important. It is not only should be given to the adults, we should also educate the children, so that we can have an healthy generation. Next generation will be like healthier. Okay. Yeah. What are the prevention methods, like medication, lifestyle choices, treatment
Ma'am,
for infection? Yeah.
your screen is again minimized. Could you please give the play button so that
Yeah, yeah,
we
yeah.
can?
Yeah, I'll do. Yeah. Post prevention methods and all, like medication, lifestyle choices, like avoid tobacco, limit alcohol, carcinogens, avoid obesity, treatment for infection. I said like human papillomavirus, hepatitis B, C, Epstein Barr, H. pylori, many viruses causes. Screening, yeah, earliest in early stages itself, you have to go for screening. And in screening procedure, you can't say like only this for this. No, not like that. For every cancer, the screening test in the procedure will vary. Okay, wow. Let's see for breast, lung, and cervical cancer because those are the topmost cancers in India. Okay, for every other cancers and all, like laryngeal and esophageal, I said right. For that and all, the screening test is different. That is completely different. You have to consult a doctor for that. And vaccines and protect vaccines to protect, like human papilloma virus and all. We have vaccines. We can protect ourselves from cervical cancer and all. Surgery, I said that breast cancer and all. Yeah, to remove the tissues of risk such as women with the increased risk of breast cancer and ovarian cancer, the entire uterus can also be removed in case of cancer in the uterus or ovarian fallopian tube and all. Okay, next one is like most common types are breast cancer, lung, and cervical cancer. We are running out of time, so I'll try to complete it fastly. Yeah, I said right. It will spread to the lymph nodes and all. So stage 4 of the breast cancer, you can see the tumor here. Yeah, these are the lobules. It is started to. It just started to spread to the next lobe. It just started here and spread to the next lobe, then to the next lobe, and it is spread to the lymph node and all. And later on, this is going to have metastasis that is spreading to the other organs and other parts of the body, like the lung, liver, bone, and to the brain also. Okay, this is the last stage, the final stage. You can only support them. You can only rehabilitate them, give emotional support and all, help them with the ADL and those things we can do. Examination and diagnosis. This is self-examination. Everybody should, especially girls, should be aware of this. Anyone can get cancer. Okay. Once in a month, 2 to 3 days after periods, examine the armpit with the raised arm. Using the finger pads, massage oil, or the shower gel, just like not even the gel or something is needed. Only fingers itself is enough. From up to down motion, just massage and see. If you can feel any lump or like tumor like கட்டி மாதிரி ஏதாவது தெரிஞ்சதுன்னா அது வந்து நீங்க ஒரு கன்சிடர் பண்ணிக்கணும். ஓகேவா? அப் டு டவுன், ஃப்ரம் டாப் டு பாட்டம், ஃபர்ஸ்ட் அப்படியே touch and see if you can feel any lump. Okay, next wedges, like from the nipple to outward. Okay, next is circular motion. Yeah, most of the lumps will be caught at circular motion. Nalla circular if you do like how we will apply creams and all, face wash and all in the face, like that you have to do it in the circular motion. Most of the lumps will be got at circular motion. And examine in the mirror, or you just look down and see what is there. If there is any lump, visible lesions and all, you have to be very careful. Next one, lumps or dimple, it will go inside and all. And any color change or dryness or bruises or swelling, anything like வீங்கி போறது அந்த மாதிரி, redness ஏதாவது, white patches இல்ல black color moles ஏதாவது வருதான்னு செக் பண்றது. நெக்ஸ்ட் வந்து நிப்பிள் டிஃபார்மேஷன், நிப்பிள்ல இருந்து ஏதாவது டிஸ்சார்ஜ் வருதான்னு பார்க்கணும். லைக் ப்ளூ, சாரி நாட் ப்ளூ, இட்ஸ் yellow or green, like that. எனிதிங் லீக்ஸ், எனி ஃப்ளூவிட், பஸ் மாதிரி, அது மாதிரி நிப்பிள் இருந்து ஏதாவது டிஸ்சார்ஜ் வருதான்னு பார்க்கலாம். நெக்ஸ்ட் வந்து நிப்பிள் இஸ் புல்ட் இன், நிப்பிள் வந்து உள்ள போயிடும். அதெல்லாம் ரொம்ப செகண்ட் ஆர் தேர்ட் ஸ்டேஜ்ல இருக்கும். ஓகேவா? ஃபைன், திஸ் இஸ் வெரி இம்பார்ட்டன்ட். யூ மஸ்ட் நோ திஸ். Next is it is self examination. Next one is clinical examination. Yeah, the same one. The nipple will be pulled in and dripping, lump, redness, rash, skin changes. The same thing only. Okay, next one is about if you go to a clinic, what will the doctor do? How will he or she assess it? Clinically, they'll first ask your age. Ma'am, what's your age? The lesser the age, the possibilities is less. The greater the age, like 30, 40 and all, after post menopause, there is a risk of breast cancer. And examination, how self done, the doctor will also do examination. Next imaging like ultrasonic scan, அப்புறம் mammography, they will examine like that. And pathology, if the tumor or what lump is found, they will just put a fine needle. Aspiration means they will take it out, like small part of the lump, not the entire lump, then it is called as surgery. Small part of the lump they will remove it, and or else the core cut biopsy is like taking out a small part of what has been detected for pathology, and they will give that small sample to the pathology lab and detect it as, is it cancerous or is it affected, it is due to bacteria, virus, or what is the reason, they will find and see. With clinical imaging and pathology only, the doctor is going to conclude whether it is cancer or like small issue, not a major issue, it's okay, like that. This is what your doctor is going to do. And the most what to say, the most effective way to diagnose mammography is mammography. Cancer is mammography, because even a small size of lump, this cancerous tumor, this mammogram is going to detect it. Even in the self examination or with the however the doctor is going to do, you can detect only a large size lump. Even a small dot, like small centimeters, also this mammogram is going to detect. So it is advised for women above 40 years, that is postmenopause women, to do mammography at least once in a year to protect themselves from breast cancer. The possibilities are high, so it is better to do an examination, like go for a checkup and get checked. Next, second most common cancer is lung cancer. This is most common in men because they go for work like smoky areas, radiation like areas and all, and they have the habit of smoking. Most in India, it's more most common in men. So occupational like miners, diggers, those people are going to get lung cancer, possibilities of getting cancer. Asbestos, silicates, these are occupational. Environmental, radon gas, those things. And genetics, if their father or brother or mother, someone who had the cancer. And smoking. Next is pollution and all, these are going to cause cancer, lung cancer. Next thing, examination. How do we do examination for lung cancer? It is with the physical examination, this your doctor will do. Like he will auscultate for the vesicular breath sounds, and any thrust or something, any abnormal breath sounds are seen. And then he will give for a chest x-ray. It will detect mostly it is detected in the chest x-ray itself. And they will go for CT for the soft tissue. What soft tissue examination, they will find any lump or something wrong with the lung can be found. And lung biopsy, I said right, a small part of the tissue is going to be aspirated, like collected and given for the pathology to determine what is the cause for the um, disease. I mean, disease, not like disease. What is the cause of the suffering? And pulmonary function test. This is the PFT done normally, and even the blood test and all they will take to confirm the disease. And next, prevention tips. It's like tips. These are not only the way, these are the tips. Okay, eat a variety of good vegetable, fruit, whole grain, nuts, legumes, and all. Check your home for radon. Avoid second-hand smoking. Do regularly. Exercise or routine. You keep it as a routine. Okay. Next is cervical cancer. Actually, cervical in medical term means neck. Whatever we say neck, we say neck as cervical. Why it is given as cervical cancer? Because you have the endometrium and the vagina. You can see cervix, and exocervix. It is the cervix of uterus. Okay, so only it is called. That is neck of uterus. So only it is called as cervical cancer. Okay, it is not the cancer in neck, like கழுத்துல இருக்க கேன்சர் கிடையாது, அந்த யூட்ரஸோட நெக்ன்றனால we say this is as cervical cancer. This happens, obviously this happens only in women because it is a female reproductive organ. Yeah. The examination is pap smear. Your doctor is going to place you in lithotomy position, that is the delivery position, the labor ward, they'll keep like that. And then they're going to insert the speculum in the vagina, and they are going to use a brush to swab it, like they will scrap it. some part of like from the vagina itself, they are going to take it out. Okay, or scrap from the cervix and examine for microscopy. And the scrapped cells and all, no, they are going to give for the pathology department. They're going to do like they're going to do the microscopic examination, and they will confirm is it a cancer or not. Okay, this is the procedure. This is the procedure what they are going to do for the diagnosis and how can we prevent cervical cancer? These are prevention tips. Avoid promiscuous sexual activity, that is like extra sexual partners and all. Avoid those things and use condoms and other contraceptives during sex. Yes, of course. Quit smoking. Even females have the habit of smoking. Like you have seen some old age women like party and all, the head of the village and all, they will do smoking and all. There is a possibilities, and not in our country but in other countries. It's in our country also it's there, but not so like other countries. So better with smoking and vaccination. I said right, this cervical cancer is especially caused, most commonly caused by human papilloma virus, and it is a virus. So we can overcome this by providing vaccination and all. Okay, vaccination of young adolescents against HPV, that is human papilloma virus, is safe and prevents cervical cancer. Okay, and other sexually transmitted disease also, not only cancer but also other. Okay, prevention overall cancer. Okay, these are three main cancers, but what is the overall prevention? Say no to tobacco, say no to alcohol, eat healthy, do regular exercise. It is easy we say that you stop using cigarette, you quit this habit, you quit smoking and all, but a person who is a chain smoker, it is hard for them to quit smoking. This is the reality. So what should we do? We should educate the young minds, the children, the youngsters who doesn't have the habit of smoking, who are vulnerable to smoking. If you take the history of people who is alcoholic or a chain smoker, they might have started it because of the peer pressure. Most of the psychiatric what you see, the alcohol dependent patients with alcohol dependency syndrome, you ask them for history, they will say like I started this at my age of 15 because of the peer pressure. Like friends will say like macha try panna, like you do this, then you are not my friend, நீ இப்ப இது பண்ணலனா you are not my friend, you are out of the gang. They will do those things. So due to the peer pressure only, people are falling into this, and once they start getting used to it, they continue, and they'll become like alcoholic or chain smoker. And once they are like alcoholic and all, if they stop it immediately. Like if an alcoholic is there, he's like binge drink, he can drink, he'll drink in the morning, it's his habit or routine. If you stop it immediately, there is a high chance of getting epilepsy and convulsions are like வலி போரும்னு சொல்லுவாங்கல்ல, அந்த மாதிரி வந்து they will undergo death. அதாவது அதுவே அவங்க இறந்து போறதுக்கு ஒரு காரணம் ஆயிடும். Like not the reason of cancer or liver cirrhosis or other damage to the body and all. Immediate stoppage of alcohol or nicotine itself is going to take away their life. So this need an medical support also to like stop or quit alcohol. The best way to prevent is you just educate the children so that they will never fall into that trap and then they'll get cancer and all. Okay, it's better to educate them, because this is the reality. People just fall into that because of the peer pressure. Most of the people, so only some are like like depression, I fall like sad, I'm sad, I drink, or I'm very happy, I drink. No, like peer pressure is the main reason. So you have to like educate the children, and you have to be like keep an eye on your child if he or she is an adolescent, because the peer pressure will make them fall into like this. Not only this, but also like other substance related abuses and all. Okay, so yeah, this is the reality. So just educate, the primordial prevention is very much important. Next, healthy lifestyle. Okay, healthy lifestyle, you eat healthy, you do regular exercises, those things, promote those things. Eat more vegetables, get enough sleep, stay mindful. Mindful na, getting stressed for everything, getting emotional for everything. Whatever thoughts you, it just comes, like you just watch. what's happening, what can we do next. Like reduce the level of anxiety, drink water, get more fresh air, detox, exercise, add more fruits and all. Next one. Okay, importance of exercise. What does exercise does? Exercise panna சொல்றீங்க. What does it do for cancer? It will prevent cancers like breast cancer, endometrial cancer, kidney cancer, bladder cancer, esophageal cancer, stomach cancer, and colon cancer. These common 7 types of cancer can be like can be avoided if we do a regular exercise. It is not like going to gym and doing and all. Like regular simple exercise will save our life. So this is a very important lifestyle modification you have to do. And benefits of exercises. Yeah, stress and anxiety relief. Shuma, like we do that breathing exercise itself, this is going to calm down. Like we are weak sympathetic nervous system will be activated when we are anxious and all, and this is going to tighten our muscle, and we'll feel stressed and all. If we do like simple breathing exercise itself, this is going to act like suppress the sympathetic innervation, reduce the adrenal rush, so that your body will loosen up, like muscles ella loose ஆயிட்டு கொஞ்சம் you will feel stress free. So that is very simple exercise, the breathing exercise. So this is going to reduce the stress and anxiety and improve functional mobility. Functional mobility is like you walk, you can do a function by moving. Okay, that is what is called functional mobility. லைக் ஏதாவது ஒரு வேலை செஞ்சா லைக் இடுப்பு வலிக்குது கால் வலிக்குது அப்படி சொல்லாம நீங்க எக்ஸசைஸ் பண்ணீங்கன்னா ரெகுலரா செய்யற ஒர்க் எல்லாம் உங்களால ஈஸியா பண்ண முடியும். லைக் ஸ்டேர்ஸ் ஏறினாலே எனக்கு முட்டி வலிக்குது அப்படின்ற மாதிரி இல்லாம ஸ்டேர்ஸ் வந்து இட்ஸ் அ ஃபங்க்ஷனல் திங். Okay, if you climb up the stair you will not feel that much pain if you do a regular exercise. Next one, increase energy level. The energy level will be increased, like you will be like energetic every time. You don't feel fatigued, ayyo pa, but I like not like that. You feel energetic all over the day from the morning to evening. And improved overall health. It is given as overall health because we also have to concentrate not only on the physical health but also on the mental health. Okay, the mental health not only depends on the single person, it also depends on the family, friends, and society, everything and all. So that balance, if any imbalance is happening there, then it is going to affect the mental health. So exercise can improve the overall health, both the physical and the mental health. And better sleep. Of course, if you are like physically active, you will have a very good sleep. And higher self-esteem. Your self-esteem is going to get boosted. If your mental health is good and your energy levels is good and if you are stress-free, then obviously you have a very good self-esteem. Yeah. And yeah, let's be aware and thank you. Thank you guys.
Thank you so much, ma'am. You taught us all about what and how do a person gets affected of cancer, its precautions and preventive measures, statistical data, etc. You also told us about breast cancer, lung cancer, and cervical cancer, and how should it be prevented and also its symptoms. You also demonstrated us on how to have a personal check ourselves on the symptoms of breast cancer. Thank you so much for your valuable teachings, ma'am.
Thank you.